Okay, the second presenter is Ibu Yasinta from Universitas Pajajaran, Indonesia.
Yes.
Okay, Mr. Tunggu, can you stop the screen share so Ibu Yasinta can share?
I'm struggling how to stop.
Okay, it's okay. I think there is a button.
Dr. Malan, you could
yes.
see something at the top of the screen that says stop sharing in red.
Stop. Yes.
All right.
Yeah.
Okay. Perfect.
Thank you.
All right. Thank you.
Okay. So Ibu Yasinta from Universitas Pajajaran, Indonesia, will present her paper titled "Cost Effectiveness Analysis of Oral Iron Treatment for Iron Deficiency and Anemia Patients in Teluk, Bintuni, West Papua Province, Indonesia." Please, Ibu Yasinta, you may share your presentation.
Okay, thank you for the time, Mrs. Kumala. Okay. Is my screen on
Yes.
right now?
Yes.
Okay.
You can see it.
Okay, I'm Yasinta from Universitas Pajajaran. We'll be presenting about cost effectiveness analysis of oral iron treatment for iron deficiency anemia patient in Teluk Bintuni, West Papua Province, Indonesia. This is my team, and the background in this study is in the global, oral iron is a drug of choice to treatment patient with iron deficiency, and lots of preparation formula are available in societal. Patient will be confused to choose which one is appropriate with their need. Its profile have been known as low cost, effectiveness, safety, and tolerability. But there is no scientific base of the cost of effectiveness of oral iron product for patients with anemia until now. In Indonesia, anemia proportion of pregnant women increased from 37% to 48% in 2018, dominant in adolescents in 15 to 24 years old. This is from Riskesdas 2018. In West Papua itself, oral iron distribution in West Papua did not reach the target. It was only 40% from the target. In Teluk Bintuni, the prevalence of anemia, 1 of 2 women of reproductive age was anemia. This is the position of West Papua, the second last in Indonesia. And so the objective to investigate the cost effective of oral iron treatment for iron deficiency anemia patient in Teluk Bintuni, West Papua Province, Indonesia. The method is an experimental study design, proposed sampling with inclusion criteria. We get the final complete data is 110 patients from a reachable population 875 women of reproductive age. And then all treatment costs from 2 perspectives, is healthcare and societal. And we use the patient quality of life as the effectiveness indicators, AQ 5D 5L questionnaires like Mr. Tunggul first, but he used the 3L, 3 level. This is the we examination the mobility, self-care, usual activities, pain or discomfort, anxiety or depression. There's a 5 level. And the dominant characteristic patient in Teluk Bintuni who suffering of anemia in 15 to 20 years old. And from Papua and non-Papua ethnic, the most suffering is in Papuan ethnic. This is the total cost we collect from two perspectives, and the blue one is from healthcare perspective. In the left is ferrous fumarate, and this is the ferrous gluconate. This is the kind of tablet that's available in Teluk Bintuni. In the black and the brown one is supplied in drugstore or apothec, but in the red one from Dinas Kesehatan or the government healthcare, from primary healthcare. And this is the utility score among anemic women. And the ICER incremental cost effective ratio from ferrous fumarate, we got 28,646 rupiah to get one quality per one quality. But in ferrous fumarate, if they use ferrous gluconate, they need the adding cost or incremental cost in 13,020 rupiah. So the conclusion, the ferrous fumarate from distribution from the primary healthcare from our government is more higher level of effectiveness, but it's more higher cost. So the location in the northeast, applying the cost effectiveness plan, the use of ferrous fumarate can be concluded in the northeast quadrant, in which its intervention generate more health gain, but it's more effective, more expensive. This is in the rural area. According to Mr. Chunggu before, we are the same characteristic that the rural area more higher in anemia, their women of reproductive age, than in the urban. Maybe the distance to get the healthcare facility. Thank you.
Yeah, thank you very much, Ibu Yasinta. It was a very short but interesting presentation. We have a lot of time. We have like 4 minutes to question and answer. Maybe the audience have question for Ibu Yasinta. Ibu Yasinta, if I'm not mistaken,
yes.
The treatment that was provided by the government is more cost effective or less cost effective?
More cost effective.
Okay. Yeah. Okay. So it's good for the rural area, yeah, to use this kind of treatment.
Yes, that's good.
Yeah. Is there any question from the audience for Ibu Yasinta, or maybe you want to share more, Ibu?
Okay, maybe we can discuss with Mr. Chunggu.
Yeah.
Because we are the same character of our population. Yes, the ethnies.
Yeah.
But maybe different age. In mine, my population in women from 15 to 49. Women.
In your
yes.
Yeah. In your experience, will there be any difference with different ages in this cost effectiveness research?
Pardon? I beg your pardon?
Do you think there will be difference in cost effectiveness research based on age of the participants?
Yes.
Okay.
Different, because in the loss of productivity,
Yeah.
in the lost productivity, we counting the income of the sample of the subject. If elderly, yeah, I don't know. They come the when they wanna go to the healthcare center, they need to cut off or to take off day. To not working for one day, minimum 1 day, because of the distance, especially in rural. The distance from their home to health center is need much time.
Yeah. So that will cause the difference between ages. Yeah.
Yes.
Okay. Thank you very much, Ibu Yasinta, for the presentation. You may close the share screen, and we will continue to the next presenter.
Okay.
Yeah. Thank you very much.
Thank you.
So, okay, the third presenter is Ibu Dewi Sarah from Universitas Pajajaran Indonesia.
Observe.
Ibu Dewi Sarah, I think she is here. Yes. Okay. Yeah. Ibu Dewi will